Welcome everyone to the New to Medicare Part D webinar. My name is Tom Ryan. I'm with Provider Outreach Education and I'll be your presenter. Today I'm joined by Aline Ziegler from my team who's going to help me with technical problems, and she's going to look at any questions that you put in chat and present those to me. One of the things that I do want to bring up is this is designed for people that are new to Medicare, as the title states. How do we define that? This is designed for people that have under 1 year of Medicare experience, but it's also designed for those that are wishing to do the basic Medicare review. Again, basic Medicare review. No in-depth questions, no kind of comments like that. That's not what we're looking for here today. We do have other webinars covering some new to Medicare information, and each month we offer one webinar. Now, again, depending on, you want to check your advertisements and make sure that you have that. We do also have an encore list, and we'll talk more about that in just a few moments. But the encore list may be helpful if you have someone new or you yourself are looking for more information. Next is housekeeping. So some basics. One, we do want to let you know that if you are interested in downloading the handout, we do have this available for you. It is in the training center. Now, the training center is a portion of our website. That's what it's titled. It's going to be right on the very top of our website, kind of in the middle. And inside there, you're going to have a couple of different areas. Currently, if you're interested in downloading the information, there is a live events page. This is in the training center again. One of the things I will ask Aline to do is to put a link in the chat to that page so that we have that available to you directly. But also in the training center, you will see an encore presentations page. The reason that I bring this up is give us a few days. It could be a little bit delayed to the holidays, so it could be a couple weeks up to this one. But our goal is to get an encore presentation or this recording out there as quickly as possible. Now, again, that will depend on the quality and all of that information. One of the things that we do with an encore presentation, however, is that we'll repost the slides so that you can have those available for 60 to 90 days. So they'll be there if you need them. I will let you know that for this webinar, I'm only taking chat questions, so please put them into the chat. We'll get those answered for you. And last, of course, CMS would love to hear your feedback. I would love to have your feedback. What we're looking for is for you to complete a survey after the event. It's just going to help us a little bit with understanding what we have, what we need, and what I could do better, what you liked, all of those different basic things. So a couple of basic disclaimers. This is an educational presentation. I think I've already talked about that. The information within it was current as of today when I checked everything, but I will let you know that Medicare rules do change often. Therefore, the information may need to change, and it's the provider's responsibility to keep up with that information. The provider is the billing entity that is billing Medicare and is paid. We will give answers based on the questions and the facts given within those questions. But remember, Medicare final rules always determine final coverage. The reason that we put that in there is some of the questions are a little bit vague, and I'll try to point those out, but other times I'll give them as best I can. For the most current information, please access the CMS website. This is going to have your coverage, regulations, and rulings, and links to all of those different pieces of information. One thing that we do ask is that you do not record this presentation. CMS does prohibit it for profit-making purposes, but because we don't know if you're going to use it for profit-making purposes, what we will do is record it. Again, we will post it to YouTube as an encore and then link to our website as an encore. Now, the encore YouTube playlist will be available to you and is available today. We will add it to any of the appropriate, especially the new to Medicare playlist as well. So if you're having any issues, please let us know right away, and we'll get all that done for you. Also, check out the encores if you're interested in more information on new to Medicare. Oops. So what is our goal today? Our goal is to help you understand what Medicare Part D is and what it covers. We do receive some different questions. Now, keep in mind, we can't talk about the individual plans as we are a Part A and B Medicare Administrative Contractor. I will define that a bit more just in a couple of slides here for you, but just keep that in your back of your thoughts. We're going to give you the basic information, just like we said, new to Medicare. So today's education will define Part D. It's going to explain the Part D basics, and then we're going to answer the questions that you submitted. What I've done is look at the questions that were previously submitted or the questions that came from the informational sessions for new to Medicare. also the questions that you submitted for this one. And I've decided to try to answer them as we go versus just moving them all to the end. So I'd really like to keep that up, and I will the opportunity to ask questions at multiple points in time as well. I just think that's a better flow. Hopefully, it'll help you out a bit more. So the first question that we actually did get is, why does Part D matter to a doctor, to a physician? And let me go ahead and answer that with the statistics. In 2023, more than 50 million of the 65 million people covered by Medicare are enrolled in Part D plans. So that's a lot of people. This means that just like with other health insurances, your doctor may need to be aware of the drug plan's formulary. That drug plan covers which type of medication and whether it covers the generic, the non-generics, all of those different types of things. So if they're not aware of Part D, they may need one of their staff members to help guide them through this process. But that's why it's important. Part D is growing. And again, 65 million people are covered by Medicare, and 50 million of them do have a Part D plan. So that's why we feel it's important, and that's why Medicare feels it's important, because it is such a big part now of the parts of Medicare. Let's go ahead and move through some different definitions. This particular section will really just give you some basics of what you have to know for Part D. It's going to give you a variety of terms and it's going to define them. It's not going to get into a lot of detail because our real goal is to get you some understanding when we really look at it. The first one actually was interesting because one of the questions we got is, what is the difference between Part D and a PDP, which is a prescription drug plan? Now, Part D is Medicare Prescription Drug Plan, or PDP. There is no difference. It is the same thing. The prescription drug plan, or PDP coverage, is pharmacy coverage for prescription drugs. The caveat is that it excludes drugs covered under B for biologicals and drugs. So Part B is medical insurance or supplemental insurance. Some people call it either way. Really, it's your outpatient type coverage. So it could be in a facility setting, such as a hospital or critical access hospital, but it could also be something covering supplies, such as an ambulance supplier or testing. All of those types of things could fall under Part B. But remember, the key thing there is outpatient. So Part B was originally one of the parts of Medicare called traditional Medicare. Part D was the addition. So what they did in the law, and what they did when they put it in, is that if Part B covers it, we're not going to add additional coverage with Part D. Instead, we're going to exclude it. So Part D is your Medicare prescription drug coverage. Again, this is your pharmacy coverage, over-the-counter drug coverage, things like that can be included, but for the most part, it is those pharmacy prescription drug coverage. Each Part D plan, just like a commercial insurance, does have a formulary. Now, when we say formulary, this is the drugs that are covered. These can vary. CMS does require certain categories of drugs to be covered. Now, sometimes they say all drugs under this category, and sometimes they say maybe only 2 drugs under this category. And this is why some of the drugs are covered and some are not under a formulary. So just like with regular insurance or private or commercial insurance, Medicare Part D has these basic coverage plans. So when Medicare says Medicare Part D plans must cover at least 2 drugs for the following categories, then there's very specific. On the other hand, they do say all drugs for categories such as antidepressants, HIV and AIDS treatment, antipsychotic medications. So you can see some of the bigger ones are these types of drugs. Now, one of the caveats that someone did ask me is anti-cancer drugs, and are they covered under the formulary? And the answer is yes, they are covered. All formularies must cover all forms of anti-cancer drug. Here's what they don't do though. If it is a Part B anti-cancer drug as defined by the list on the CMS website, then no, that drug is not done. And we'll show you that list in just a little bit. So it's a variety of different interesting things. CMS also goes further and says that a Part D plan may not cover drugs purely for weight loss. Now, if weight loss is a that a side effect, like some of the diabetic medications, then yes. Diabetic medication would be one that they do have to cover two of at least the major category within that. Erectile dysfunction is not covered, and fertility drugs are not covered. So again, let's jump back to that question that we got. Why does all of this matter to your doctor? And the answer is a Medicare drug plan can make changes to its list during the year if it's following guidelines set by Medicare. So not only does the doctor have to be aware of it, but what happens changes occur. The drug plan contacts the patient. Well, who does the patient typically ask questions of when something changes within their plans? My doctor, my doctor, my doctor. I want to talk to you about this. Hey, I got this notice. So if the doctor is not aware of it or their staff is not aware of it, they can't advise the patient as to which plan or whether or not they need to change a drug. Okay. And we'll talk a little bit more about that in the Part D specific information. Okay. So again, the patient's plan change a drug list during the year because the drug therapies change, there's new drugs are released, or other medical information becomes available. We know that. So then the patient does have to come back to you and they have 30 days to make these decisions on whether or not they want to stay in that drug, whether you as your physician want them to stay in that drug, whether there's a different off brand you might want them to use, or all of that different type of information. Keep in mind they will be allowed one refill. It's within 30 days and they're going to get a refill on it. And that's how Medicare is going to inform them. Once that refill is complete, though, that's when they typically contact their physician and try to get through something that is going on. So we really want people to at least be aware of the basics of Part D. One of the questions we did get, and I will talk just a little bit about this, how is Medicare inform the patient of all of their different benefits? Now, again, this is much a broader spectrum submitted during this class, but it is the Medicare You handbook, and this is the a handbook sent to each Medicare recipient or a household if that's how they elect to receive it. It is downloadable by providers at any time. However, in a lot of cases, most people are not aware of that because we don't go to Medicare.gov. We don't go to the patient website where it would be stored at. Now, one thing to keep in mind about the Medicare You guidebook, the information within it is somewhat customizable. So if you're in a certain section or area of the United States, this can be different than if you're in a different area of the United States. But the guidebook is still the basis for what a patient gets. Now, that the reason that they do that is to say, hey, when we talk about Part D plans that are offered here but not over here, or you talk about Part C plans, and we'll talk about those in just the next section here, which is Medicare Advantage plans, they may or may not be offered across the entire United States. So we want to make sure that we're addressing all of those types of things. Somebody did ask if I could show you guys where Medicare You is located. I will do that, and then I will open up for questions. Sorry. There we go. So then we'll open up for questions. That'll be your first opportunity for that. So if you have questions while I do this, definitely put those um into the chat. All right. So first of all, remember I said the website that you may be familiar with is cms.gov. That's not the one we want. We want Medicare.gov for this one. So Medicare.gov, you can see this is the patient portal. It's going to be designed at a different speaking level and reading level than cms.gov. This one's designed at about 6th grade. Okay. So when you look at all this different information, one area I'd like to point out, it says find health and drug plans, and it's also going to be up here. This is a comparison where someone can log in and compare the different plans that are available in their area. Drug coverage for Part D, you can learn more about it right here. Now, why am I showing this to you as a representative of the providers? Because sometimes when you're first getting started, it's nice to come out and read the basics and the general high-level information as written for patients, and that's what this will be. So this will just kind of explain a lot about the information that you're going to get, and you can click on any of these 3 links. So what are we looking for? This is where we're trying to help anyone get through the different This is those list of formularies and drugs that I talked about. It also explains some of the tiers and why people may or may not want to use certain drugs because they may or may not be more expensive. The guidebook itself, though, will be under the next category to the left of that, and that is your basics category. And if you go under resources, you'll see Medicare and You handbook. Now, the Medicare handbook, again, this is a downloadable. You can completely download it, grab the PDF, take a look at it. The one that's on the CMS website is very generic. It's the most general one, and it's done that way on purpose. The more specific obviously would be sent to people within their own region. One question that was asked also, and I did want to address this. If you have a question from a patient and they're looking for Part D plans, something isn't making sense to them, they're really struggling, and your provider has tried to help them, you should refer this patient to 1-800-Medicare. Start there, get them back to their basics, and that's where they need to go for that. All right, so that's the last pre-submitted questions that I have. Aline, do we have anything?
There are no questions in chat at this time.
Thank you. All right, so let's go ahead and move on then. The next section is just some basics. So here we're really going to focus on Part D, and we're going to focus on the information you need to know to understand, one, how it works, why it works the way that it does, and how the patient can actually get this. So what are they getting? Again, they're getting prescription drug coverage, outpatient pharmacy coverage, so long as it's not covered under Part B. And each year, the patients actually must pick a plan. Now, for some, the plan will just continue over. For others, they do have to do an enrollment. The initial enrollment period is 3 months before the 3 months after Medicare starts. What? So we started and you look at it. Let's say your Medicare starts January 1st. October, November, and December, you can begin. Then you start on January 1, then you have January, February, and March. This is what they refer to as your initial enrollment period. The first time you're eligible to enroll in a Part D plan. Now, this is also the same initial enrollment period that would work for Part C, which is Medicare Advantage, Medicare HMO. There's a lot of different names that go with Medicare Advantage or MA plans, Part C plans. Some of you may remember the old name, Medicare Plus Choice, still the same thing. Okay, so we'll talk about that initial enrollment period and how that affects everything in just a few minutes. Each year after your initial enrollment period, there's also what is referred to as an open enrollment period. This is typically October 15th through December 7th. This one just ended. What this will do is allow a person to enroll in a new plan, switch from one plan to another plan, or completely get rid of Part D and stop paying all expenses related to it. So there's a variety of factors that will go into it. The last time the patient actually does get to make a choice is what they call special enrollment periods. So when changes happen within their life, they're moving. So now they don't have that plan as an option at their new address. Or sometimes loss of primary insurance. So their spouse is retiring. So they're not retiring, but their spouses can affect their coverage. So then CMS does allow them to begin a new plan. Now, what's important for you to understand that typically you will see plan change, one, when a person is enrolling in Medicare. Two, you will see a plan right at that October to December. So starting in January, again, ask again, try to figure it out. We always recommend that. But three is the special enrollment periods. And you want to make sure you're keeping track of this. Now, because they can be included in a Medicare Advantage plan, and we'll talk more about that in just a few moments. I was asked if there's an average cost per plan, and I want to make it clear on this slide, it's very average based on the question, but also because each plan does vary and is unique and can offer a variety of different things. But keep in mind, Part D is separate from Part B. So average is about $55.50 a month, but that $55.50 is a separate premium from both Part A, Part B, and it could also be separate, but it would not be separate from Part C if they incorporated this into and depending on the plan type. So really this premium is going to vary based on the plan and the coverage that they offer. So there's no like set, it has to be this amount. That's not how it works. You shouldn't be advising a patient on that type of information. That is something that they can work with Medicare on. There's something called a state insurance counseling program called the SHIP program. You can look that up on medicare.gov and refer them to that appropriate contact if they need to. Also, always keep 1-800 Medicare in line. There is a penalty for late enrollment. So if you are eligible and you don't have any special circumstances and you choose not to enroll and nothing happens, you can actually be penalized for not choosing to enroll. This is like a lot of other insurance plans, and that you pay so that when you need it, it's ready and it's available to you. But if you don't pay, then there's a penalty for it. Okay. The plans do vary, and there are a variety of formularies. So it is a per drug coverage plan. Depending on, and you saw that when we looked at the website, you saw, hey, there's something called tiers. The different tiers can have different deductibles, copays, and insurance, or even waive all of that. So there are some plans that don't offer any deductible, copay, or insurance. It just depends on the plan and the type of tier that it has, the type of plan that it goes with. So that's why it varies so very much. When you look at this, one of the interesting statistics about the cost is that some people will choose Part C plans to incorporate the Part D plan as well. And that means one cost at a time. And we'll talk more about that on the next slide. So how patients actually get Part D. So yes, we understand that they enroll, and yes, we understand that they choose to have this. They do enroll with each private insurance company. So they do not enroll with Medicare for this. They do not enroll with the Social Security Administration. They do not enroll with the Railroad Retirement Board. Each company takes its own enrollment and has to track that enrollment. So this is a separate system that is used. And this system then communicates with the Medicare systems. Okay? So it's enrolled in a private company. Now, keep in mind that Part C, the Medicare Advantage system, does also contain a portion that can be Part D. So they could enroll in a Part C plan or Medicare Advantage MA plan, and that would then communicate back and say, yep, not only do they have this, but they also have this, which is Part D. So they have the replacement for A and B. They could also have Part A and B and D. So they could have 3 parts of Medicare. So 1 part or 3 parts. Remember, Part D is always optional. That prescription drug coverage is always optional. They can never have, or not never, they will rarely have a Medicare Advantage with a separate Part D plan. We say rarely because the MA plans, for the most part, do not exclude Part D coverage. Of course, there are unique ones that do, but you'd have to take the class that was held last month on the MA plans, and you'll hear all about that. The statistic here says that 56% of people with Part D use the Part C plan or Part C plan drug coverage. So this means that they're enrolled in a Medicare Advantage plan, and as part of that, they're getting their Part D. While 44% of people that have Medicare are in standalone Part D plans. So that's just not the people with Medicare Part D. Now remember, not everyone chooses to take this. So we know that this is an uptrend. They're pushing more into the MA plans because the MA plans themselves are an uptrend. So when a person opts in, they have to look at the overall picture, which is why that special enrollment period that we talked about and that initial enrollment period that we talked about affect both Part C and Part D. So hopefully all of that does make sense. Again, Part D is private insurance. That private insurance company has a system that they use. That system then enters information into the eligibility files. That eligibility file communicates with the Social Security Department and Railroad Retirement Board to say, hey, they've got this, don't do this. What that does then at that point is puts it onto the common working file, and the common working file is the file that we access as your Medicare administrative contractor to process claims. But the reason that it's important to understand that is all of these links are supposed to work together, but on occasion they will break. And that was one of the questions that someone asked me about this. What happens if the files are not correct and are not correctly updating? The answer is we, as your Medicare administrative contractor, cannot affect change in any way. We can't fix it, we can't change it, we can't really work with that portion. We take a read off of the common working file. So you have to go back to the plan, maybe go back to Social Security, go back to the patient. Somehow it has to be fixed if they have an MA plan with a Part D plan. Okay? Because that can also then override the Part B drugs as well. The Part B and Part D drugs will all be overridden if they have a Part C plan or Medicare Advantage plan. So just a lot of stuff to go back and forth there that I really wanted to make sure you guys were aware of. Let's go ahead and move on. Oops, too far, sorry. Next, I just like to run through some different resources. Now, you do have resources, and these are all linked within your information. What I'd first like to do is talk about the PDP Plan Directory available on the CMS website. You can directly click and use any of these. These are all hyperlinked. Well, or not today. There we go. And so this will take you out into the PDP Plan Directory. Now, if you're not really feeling this and you're like, well, I don't really know where I want to go, remember I did tell you that your official website is cms.gov, the patient's is medicare.gov. So we can also come out to cms.gov and we can go to this information too. It just depends on what you want to do. One thing is when you're looking at cms.gov, if you notice mine, a lot of times will open like this. I need this data and research area up here to get to the PDP Plan Directory. Now, the directory is nice in that it does help you understand what types of plans, if there's Part B, things you have to know. So things like that. But it's under the data and research area. So it's not going to be part of Medicare or any of these other ones that are going to show up as the tabs. It's under data and research. Top right next to the search feature. And once we open this, you can read through and you're like, okay, what am I looking for? Because it doesn't say PDP plan or prescription drug plan. So what you want to do is come down into this section, which is data and research topics, and you can read through the different topics. And we're not going to actually read through all these topics. We're going to go to the statistics, trends, and reports right here. Now this is just, I know where it's at. That's why I'm navigating this, but I also gave you that specific link because sometimes it's just easier not to navigate and to be like, Tom gave me a presentation, it's done. I don't have to go and look for it. Here you can see the Medicare Advantage Part D per contracted enrollment data right here. That's on the right side. It's going to be the top row in the body of the links. If you click see more, it will open up the full set of information, and then you can look on the left side. Okay, and I do like to scroll down just a little bit. You can see there's all kinds of files. As you scroll down, you'll come to the MA plan directory. This is for Part C. So if they have a prescription drug plan that is part of a Part C plan, this is what you're going to look at. If not, you're going to look at the PDP plan of the prescription drug. So again, up to you to look at that information if you want to, if you don't want to. More commonly, the one that people are looking for is this MA plan directory, because this is the one that some people say, hey, we have issues with. Where do we go with the issues? How do we get them to do what we need them to do? That's just going to be more common, but it's not possible to look at the prescription drug plan directory. There we go. And when we open it, it is going to be a zip file. They do update this monthly, so each month there will be a new file available to you. I'm just going to go ahead and place this on my desktop to open it up real quick. You'll begin to see real easy that it isn't a hard file to look at, or it isn't super complicated at all. Nope, that's not it. Try this again. All right, well, there you go. see that it opens like this. This is my desktop. This is the file that I want. And you can pick any one. Now, these are all going to be the same as a text file. These are Excels. We'll just open the regular Excel that most people are going to be familiar with looking at. All right, so I do have this open and it is not loading onto my desktop again. Oh, there it went. It's reopening it, so I apologize. But it'll actually show you the different, what's important about this is it works very similar also to the MA Plan Directory. It'll show you some legal names, organization and marketing name, which can be different. And that's important to understand because what a patient knows it as may not be the legal name. So therefore, if you're having questions or issues, sometimes you have to be able to go back and forth. Now, same thing with the MA plan, it'll have those two. Again, that's the Part C plans. What I like about this is that if I come all the way over here to column I, you can see which regional office is responsible for that plan in particular. So if someone's visiting you and they're like, well, this doesn't make sense, or I'm having an issue with this, and you're like, well, it's not really one that I'm familiar with, you can always come out, check for your organization and marketing name, and then go back over to the legal name. But then you can also find out which regional office you would have to contact. And you could go back through a variety of different pieces of information. I just want to scroll through and you guys can kind of see the different information that's available to you. So again, just a nice tool to use. It'll work the same as the MA Plan Directory. So if you're having issues with MA Plan, I do recommend also using that. Apologize for the delay there. Next question in regarding this particular resource is how do I find those regional office contact information? That's going to be about CMS right here. So we found out that it's in the Boston regional office, in the Chicago regional office. It's in, whichever regional, Kansas City regional office. So you can go to about CMS right up at the top. And if you look, you can read through all the different things, but there's a contact us section. So who we are, what we do, and then contact us. Again, sticking in the first row. This will alter depending on how big your screen is and your font sizes, but contact CMS, this is what we're looking for. You can also click the will work as well. You can go through and you can find a bunch of different information, and here's your regional office. Contact information for CMS regional office, and you can download that. So hopefully that works for you. If for some reason that one isn't working, which we have seen it, it's got updates and whatever going on. Some people prefer to go directly to the database, and again, you can do the same thing and you can select what you need and then hit show contact. So those are just a couple of options if you're trying to find help with these different plans and you need to go a little bit further into it. We do recommend those. One of the next areas is just the improvements, and it talks about Part D improvements. That's going to be your next link on your slide. I'm not going to go through this one real in depth, but I just wanted to mention it and say, hey, this is out there. It is something that you might want to keep track of if you want to know what's going on with Part D and why your patient is asking certain types of questions, especially when they bring up general information or they bring up, well, something changed and I'm not sure what it was. So that's where we get some of that information. I do like this one, which is the prescription drug coverage general information. This was important for the providers in that it provides you the information CMS really expecting you to know about the prescription drug coverage, but also that what your provider should know and how they should be able to communicate back and forth. So this one I would like to take just a moment. Again, I'll open it up by simply clicking the link. You can do, and there it is. It's not hard to find at all, but it does walk you through some of the memos and some of the information you might want to know. You can see all the new 2025 stuff is just coming out, so that's great. I do like that. If you want to actually navigate to it, we'll come back here to the other one and we'll say we want to go to Medicare. Okay. And under Medicare, you can see you've got a variety of areas to pick from. This is under coverage. Under coverage, once it opens up, prescription drug plan is in the left center column. I'm sorry, it's in the left column on the center. So there we go. And it will open, and here's just the same thing that we were looking at. What's nice again is again your 2025, your pharmacies, your retails, your announcements, all of those types of things are here for you. I really would recommend stopping and just taking a look at this information if you do have questions, if you have concerns or anything else that comes up. Um, Again, sometimes it's more questions that the patient's asking and you're not sure where to go with or how to understand what you're getting there. All right, I did leave these to you already, but prescription drug plan on Part D, this is the patient's stuff that you may help them with, so I would recommend taking a look at that if you need to. All right, we do a couple of questions here, then if you have questions, we'll go ahead and answer those out. So can a patient's supplemental insurance require a person to take a Part D plan? And the answer is yes. Now, what you have to think about is, so we talked about Medicare Advantage and how they tie to that. There's also something called supplemental insurance. So they have traditional Medicare Part A and B. During that, they have purchase a plan which is supplemental to Medicare, and it specifically states within the plan that this insurance pays for what Medicare does not. So patient liability amounts, such as deductible copay. They can offer some additional benefits. As long as they're not a Medigap plan, they can offer additional benefits. And it's just supplemental benefits. They can say, hey, as part of a supplemental insurance plan, yep, we'll pay your Part A and B liabilities, but let's not forget that we also can pay Part D, and you have to follow our Part D rules. That's just normal. Okay. Does your provider need to enroll in Part D? This was a good question, and the answer is no, not normally. Now, why do we say not normally? Well, what provider is handing out prescription drug medications? Do they own a pharmacy? Are they a pharmacy? Are they giving those out? And if they are, how are they doing that? Is it from their office? What are we doing with that? In most cases, this will be non-covered if done in that manner. However, if they are part of a pharmacy, if they act as a pharmacist, if they have a variety of other things going on, they may need to enroll. So we never want to say no, but I will let you know that each prescription drug plan or Part D plan requires a unique enrollment. So just like you would enroll in Part B, you will enroll in each MA plan, Part C plan, and each Part D plan if you need to. Again, very rarely would a provider, a doctor, or anyone else need to enroll in that, but someone like a hospital or a facility that actually owns a pharmacy or has a pharmacy within them, and their goal is to give the patient the drug to take home, could need to enroll. So hopefully that does make sense. Aline, do we have any questions?
There are no questions at this time.
All right, well, we'll keep going. A couple of things that I was asked. We were asked to include the amount of Part D spending, and so like, where does this come within the budget? I think some people are just always interested in statistics, and I think that's what they're looking for here. So this slide shows that 86% of Medicare spending is Part A, B, and C, which leaves 14% as Part D standalones. But remember, when we talk about Part C and that 86%, it is still going to incorporate some of the prescription drug coverage. So in 2024, this Part D standalone equals $120 billion. So that's why it's also important. It still has to continue to fight the fraud, the waste, and the abuse, and all of those different things. Next item we were asked about was some trending information. And I think in particular, we were asked if it's more common to have a prescription drug plan stand alone, or whether it's in part to have it as part of a Part D plan. What I did is pull this slide together because what you're seeing is more and more people throughout the last few years are going to using the MA plan Part D. So it's not uncommon for someone at this point to have that, but you can see the statistics showing are going down and down. And the more common form of Part D plan would actually be incorporated into the MA plan. So with that trending, keep that in mind. The other question that came with this was, should we be enrolling in a Part D and a Part C together? We can't advise you on that, whether you want to or not. That's your provider's right. But just keep in mind, this is a revenue slide to show you, hey, if you don't enroll in a Part C plan, could potentially be some missed revenue for Medicare. And it's just a different type of enrollment, but we cannot advise you whether or not that's a good or a bad thing. That's really up to your practice. Same thing with those Part D. One of the hospitals had asked if they could enroll as a Part D provider while not enrolling as a Medicare enrolled provider. I'm not really sure what they meant by that. I'm assuming they meant a Medicare participating hospital. And yes, you can enroll in Part D and you can do that through the actual Part D plans. It doesn't have anything to do with us then as a Part AB Medicare administrative contractor. So there's a variety of different things that can happen that way if you just want to enroll your outpatient pharmacy. We thought we would include this just so you had a little bit more trending or more information. All right, let's do a couple of quick announcements, a couple of things you might want to just be aware of. As we talk about this, one of the things that you can actually look up within our eligibility systems is that they have a Part D plan. We'll contain some information on that. Well, what's going to change with that is that the interactive voice response, or IVR, is going to be discontinued for the eligibility feature. Now, I did not say for all features, I said for the eligibility feature. We have chosen to do this on January 1st. Fresh year, fresh new start. Let's just discontinue it, starting there, move forward. Does not mean that we're not going to continue to give you eligibility information. As a matter of fact, it's the opposite. We want to maintain that where we can in all other features. So this would be on our website in the Secure Net Access portal. It would be in the direct data entry system and the HIPAA eligibility transaction system, should you choose to use that. Those three are not changing and are not affected by this change. For more information and to find out what CMS is doing with this test IVR eligibility discontinue, take a read on change request 13754. It might help you understand a little bit more. But keep in mind, as I said, this is a test or a pilot program. Not all MACs are, yet most of them are, but not all of them are. Each MAC does have until March to complete this. Again, we've chosen January, but we have until March to complete it. CMS at some point in the future will evaluate whether or not they want to bring this eligibility feature back. So we don't know a lot more than that. We just know that they're looking at it. They're looking at it as a patient protection, fraud, abuse prevention type item. So we know that there's going to be more to come with it. But when we look at the eligibility feature, we want you to be aware of it. You will be receiving an email in just a few moments. The email will probably 15 minutes right after the webinar is scheduled to end. It will contain your certificate of achievement. Please keep this information available to you. Should you need continuing education units, this is where you're going to get that. Any questions, Aline?
No questions at this time.
Okay, so if you do come up with a question in the next 7 days, I'm going to take those questions, but I do need you to email them in. Please make sure that you do follow the guideline on here. I know on your slide it's going to say subject line, or it's going to say subject line, and then it says like today's subject. Cross that off. It's new to Medicare Part D. If you use the hyperlink on your slide, it will automatically open that out for you. But again, it's going to be questions, general questions. We cannot do anything specific. Remember, anything within a Part D plan is actually processed by that plan. It is a separate plan under a separate company from a separate contract from us. So we really can't even look at those if that information for you. We would like you to take the opportunity to complete the survey for us. Now, this is important because it does provide you the chance to give us feedback. I always call it my good, my bad, and my ugly. What I like to say is what did I do well? What do I need to improve on? And also, did you like my PowerPoint? I know there's some basic things like, hey, did the PowerPoint work for you? Could I have added more information, the good, the bad? What do we really want to do with that? With that, you can take the opportunity right now to go to the chat and use the link that Aline provided. One way. Two, we will send you another link, but that will be in the follow-up. So an email that comes out with your certificate will also have a link to the survey. Third way, when we close this session, you will get a redirect. The redirect is simply asking you to go to our survey. You'll see it. It's the right picture, kind of lower side here. And you'll notice that the destination is a CMS MAC FedRAMP. That indicates that it is the official CMS survey. This is not malware. This is not anything like that. It's not malicious software. It is taking you out. We would really appreciate you taking the time to do that. Oops. So thank you for attending. I do want to encourage you again, provide us with any feedback that you have. But remember, part of that feedback on that survey should be topics that you would like to see related or unrelated to new to. So if there's something that you would like to see us really delve into, great, please incorporate that. If there's something that you would like to see us do as a general overview similar to this for the new to Medicare, we'd love to hear that too. We would really like for you guys to sign up for some additional webinars. We already gave you the live events page, but just as a reminder, that's where you would find those if you don't have the e-news coming out, but we would really take time to do that. We are scheduling more and we're covering different topics from different claims views and all those different things. So please take the time to look at that information. Before I leave, I did just kind of get a quick pop-in question, and so I want to address it real quick. And they're asking on our website, what am I talking about with some of these different areas? And it must just be that you're not familiar with it. So let me just give you a couple of quick things here on our website, and then I will let you go for the day. So first, this is the login or the secure section. You'll hear me say the Secure Net Access Portal or SNAP. This is what we were talking about there. So I apologize if you're not familiar with that. If you go to the portal user manual, you can see what is available within the portal. I always recommend just scrolling down a little bit and you'll come to the eligibility check. This is where you're going to find information, but it's so much more than just they have Part A or Part B. It really does, when you get into the eligibility check, help you understand whether they have Part D, they have a supplemental plan, an MA plan, all of that different pieces of information. So I'm really going to give you guys a recommendation to take a look at that. Also, I did talk quite a bit about the training center, so let me just show you that, and then hopefully that will help answer those questions that I still have outstanding. The training center is right here on the top. Again, right in the top, blue bar, kind of in the middle. Live events is where we post all there. You can come and download that. So if this link was forwarded to you by a friend and said, hey, sign up for this, this is where you're going to get that webinar information. Now later today or tomorrow, no, by the end of today or tomorrow morning, we will remove this particular link, and so that it won't be available anymore for you to download that. However, it's not going to go away entirely, because what we will do then, it is posted in the core page right here. And in the Encore page, you'll see a listing of new. We try to post these within a week or two. And then when you open it up, you'll have a player, which is what this box is loading right here. But then you can download the material. You can also take a survey and provide it either way. We'll take that either way. So with that said, Aline, did I have any other questions that came in while I went over that stuff? We good?
No, sir, we're good.
Okay, so hopefully that ends everything. I do want to thank you guys for your time today. Please remember to take my survey. I really appreciate it. We look forward to your comments and hopefully seeing you in future education. Thanks, everybody. Have a great holiday.